Take a moment and think back to a recent visit to your doctor's office. Imagine yourself sitting in that brightly lit exam room and talking to your doctor about whatever it is that's bothering you. After a brief interview, the conversation stops and transitions to you stepping up to that exam table where your doctor performs a physical exam. Open your mouth and say ah. Take a deep breath in and out. Many of us expect this kind of physical contact at some point when we visit our doctor. Yet, despite years of such interactions, we may not realize, as patients, just how important this unspoken communication is. But if we really think about it, this touch is an important expression that signals care, compassion, and understanding. We also may take for granted how this interaction solidifies our trust in this other human being who just listened to some of the most intimate details of our lives. And beyond strengthening this bond, there's also good evidence to suggest that touch alone can also contribute to a person's physical well-being. For example, preterm newborns receiving just 3 15-minute sessions of touch therapy each day for about a week gain nearly 50% more weight than premature newborns who receive standard medical treatment. And among our most vulnerable, our elderly, those with Alzheimer's disease, tend to have an easier time relaxing and connecting with others when they experience regular touch as part of their care. They tend to be less depressed as well. So how does touch create this effect? Well, it starts at the point of contact. When your skin senses another person's touch, it sends a signal to your brain. One area of your nervous system that receives this signal is your vagus nerve, which has branches and connections to internal organs, including your heart. And through this pathway, a simple, reassuring touch can slow your heart and decrease your blood pressure, a sort of physiological calming effect. Touch also affects the chemical or hormonal production in our bodies. In a stressful situation, a reassuring touch can lower your cortisol or stress hormone levels, which can create a calming effect. A different hormone, called oxytocin, also known as the love hormone or the cuddle hormone, can be released by a friendly hug and promote feelings of trust and connection. There's plenty of research to support the value of touch in our everyday lives as well. In one French study, a friendly pat on the back from a teacher resulted in students being 3 times as likely to speak up and to participate in class. In another instance, scientists at the Touch Research Institute were able to show that massage therapy helped women experience less pain and less depression during their pregnancy. Finally, a study showed how a romantic partner's touch can neutralize emotions when a person is feeling threatened or stressed. Touch. It's something so simple, yet so important to our physical and emotional well-being. So why am I telling you all this? I started thinking a lot more about the physical human connection as our lives change with the COVID-19 pandemic. As a family physician, I first noticed this loss of touch as my offices closed and visits were canceled in the early months of 2020. Through the summer, I often spoke to patients on the phone, on Zoom, on FaceTime, and saw them in their kitchens or in their bedrooms, or sometimes even in their cars as they tried to find a quiet place to speak. Nonverbal clues to physical or emotional ailments that I would typically identify in an office visit became much more difficult to pick up through static-filled video or phone conversations. And perhaps most importantly, losing the opportunity to perform a physical exam meant that I was now practicing medicine without a valuable piece of a diagnostic tool. The emotional toll of this change was pretty real too. This job always had the ability to physically and mentally wear you down after a busy day, but I always found that the joy and the satisfaction of connecting and building relationships with my patients through talking and touch was always a helpful counterbalance. Yet, this shift to virtual medicine made it much more difficult to connect and to bond with my patients as I did before. Understandably, the shift to virtual medicine was a necessary one, and the one that I agree with. Plenty of evidence support less physical touch can limit the spread of COVID and ultimately COVID-related deaths. But we can't forget about those who survive COVID as well, and the unintended consequences of losing touch and all of its benefits. Perhaps one of the least talked about consequences of COVID is the rising toll on mental health across the world. I recently learned about this phenomenon in our country called deaths of despair. Now, deaths of despair refers to deaths related to drugs, alcohol, and suicide, and they've been steadily rising in the United States for the last 10 years, well before we ever knew what COVID was. Researchers at the Wellbeing Trust estimate a massive rise in deaths of despair in the United States, anywhere between 30,000 to 150,000 people, if we don't address issues of unemployment, social isolation, and uncertainty. Personally, I've seen some of this despair firsthand. As a doctor, many of my patients over the last 9 months have admitted struggles with anxiety, depression, or insomnia as a direct result of losing their jobs or feeling alone, or the overwhelming stress with uncertainty of their own health or the health and safety of their loved ones. And at one point I was a COVID patient myself, and I remember that feeling of loneliness and isolation as I was bedridden for about 2 weeks without any real contact with another human being. And perhaps most surprisingly, I never thought I would have to worry about feeling unsafe walking on the street or as I rode the bus, but as our president's hateful rhetoric and conspiracy theories of a Chinese virus took over the national conversation, and as videos surfaced showing Asian Americans being attacked in public, I worried for the first time about my own safety as an American citizen. It was disheartening to learn also of other Asian American colleagues who were ridiculed or harassed for the way they looked or where they came from, especially as we work tirelessly to fight this global pandemic from the front lines. And now, as cases continue to rise around us, how do we combat these feelings of despair and this loss of human touch and all the benefits that come with it? One way that I thought about it was scientifically. We know that the positive effects associated with touch really boils down to a handful of neurochemicals that are released in your body. Things I mentioned before, like oxytocin, but also others like dopamine, serotonin, endorphins. So perhaps during this time of physical and social distancing, we can think about redefining touch and focus on ways that we can achieve similar benefits. Some folks are already testing different ways to promote these positive effects. In late April, on International Dance Day, living rooms across the world morphed into dance clubs as celebrity DJs hosted live stream dance parties. Other folks who wanted more of calming group activities found virtual yoga sessions or mindfulness practices. I myself broke out of my social isolation, met up with old friends to play virtual board games and video games. I also made a point to reconnect with some family members through dinner dates on Zoom. In a slightly different vein, a recent New York Times columnist challenged readers to make conversations more meaningful, even if they are virtual. He urged us to ask elevating and open-ended questions, to offer total attention to our counterpart, and to embrace long pauses and to really listen. Now, none of these activities or approaches are particularly unique or groundbreaking, but I do think that the point here is to resist the loneliness and the isolation that creeps in. We need to actively identify and to engage safe ways to connect, to touch, so that we can limit the spread of COVID, but also curb the pandemic's toll on our mental well-being. Thank you.